Okay, so thanks so much for accommodating us today. It's a really good opportunity, not only for the task force, but for community response to present some of the work that they have done collaboratively with other services in the South Inner City Drugs Task Force, but also some of their own work within community response. And I think the introduction to the task force, again, I know that many of you are familiar with some of our work, will just allow you a little bit of context for community responses work, and it'll give you some insight into the work of the South Inner City Drugs Task Force. So the task force is directed under the Department of Health, which has been a significant move and change over the last couple of years. And we really value the fact that it's been considered more of a health-related strategy. And so the vision then is for a healthier, safer Ireland. Public health and safety is protected and the harms caused to individuals and families. And we use this vision and we focus very much on the person when we are developing our work plan, and we will be developing a strategy starting from next year. This map just gives you a very brief idea of some of the services that we channel funding to. Some of them are no longer in existence, so we don't channel funding to FRC or Mercy Family Centre. But when we discontinue funding, we have a very strict criteria and a process that can last between 2 to 3 years, and then this funding must be utilised again for what we call immediate needs or necessary service provision. Just to point out that the task force is not a funder. It gets funding through the HSC. It receives a budget in the same way that the other projects receive a budget, and it is bound by the same code of governance and financial expectations as all of the other funded projects. So while we do have an operational budget, we can't fund any initiatives. But what we do is we try to create different initiatives to collaborate with other services, and you'll see a lot of that now when we come on to the presentation from community response. And we also generate and issue grants for communities, and they also have very strict criteria and are assessed by an independent external person. So these are our members. So under the Department of Health, there's a sub-department called the Drugs Policy Unit. It sets down kind of the governing rules for each task force. So we must have an independent chairperson. And then there's representatives that come from the statutory sector, which are sent to us. These are mandatory positions for them. And then you'll see that, for example, unfortunately, probation services wasn't filled. And then for the community sector, we have 4 vacancies. So we're always trying to encourage people to come and work with us on the task force. So we appreciate that a lot of people have commitments in other subgroups and different committees. So again, CORN is a great way to liaise and share information and build on communications. The voluntary sector, JM is a representative of that, is for all of the funded projects. We're trying to update maybe the criteria for this, because we recognise more and more that the voluntary sector goes beyond those that just provide drug and alcohol treatment. And I think it's important to build the stakeholder involvement and to progress beyond those services that are just really fixed on addictions services. We also have the public representatives. Again, these are nominated to the task force. So you don't get to pick and choose your political party, which is good. So we try to encourage them to participate as much as possible. Fortunately, a lot of the public representatives also have jobs. So we try and create subgroups in different meetings to really build on our communication so that the different members' voices aren't lost because they just don't attend a meeting. I'm not going to go through each of the goals, but I really just put them here so that you have a sense that the National Drug Strategy is built into different goals. And not all of the goals are for the drugs task forces. It could be that the HSC or Department of Justice or Garda Síochána would be that lead. and they may call on us to be partners. And then there's very clear goals where we are the lead and we must deliver on them. So the goals then inform our work plan and how we develop our work plan themes and how we deliver work and how we partner on different initiatives in the community. So Goal 4 is a really big one for us. I think because we are so focused on the person, and it is part of our mission statement, that when we are developing anything, whether it's quality service provision, localized grants or training, that we bear in mind, how is this going to have a beneficial or positive impact for those individuals and families and people living in communities that are impacted by drugs and alcohol. So the guiding goals then for the task force work, clearly to be service user focused, identifying emerging needs, and we do that, and we really rely on people within the community and the other stakeholders and members to let us know what's happening, to provide us with data, to share their information, their research and report. And then we have to deliver on the National Drug Strategy and the Interagency Framework piece, which is called the National Drug Rehabilitation Framework. Because the funding that we receive is set down by that criteria. Another big part of what we do is we try to underpin all of our work with the Irish Human Rights and Equality principles. We think that this is really important, that no matter what our work is, that we're very clear on the ethical principles that we employ. So as Section 42 public sector duty is coming in and being made mandatory for statutory bodies, it is anticipated that it will be mandatory for Section 39s and anyone that receives government funding. So why not use it and use it as a baseline to really inform your core principles of your work? So our work plan themes for 2021, we break it up into different sections. So we focus on the service user. There are people that are coming into services, whether it's family support, whether it's receiving information, if it's to do key working, if it's to prepare for rehabilitation. Then we've done some work around community stakeholder and dialogue plans. We did a little bit with Can and Peter Dorman around the drug-related intimidation. Project monitoring reviews are ongoing. This is a piece of our work that we are obligated to do with projects, is just to ensure that they have what they need and they are delivering to the highest standard and they're meeting what we call organisation culture of care, that their governance is in line with the governance code, the charities regulator and the national standards for better, safer healthcare. We also work with projects around sustainability. Governance is a big part of that. And I think we've noted over the last number of years that there's been a lot of pressures put on projects that are not just financial, but changes to how service delivery needs to change to meet the ever-changing needs of drug use and drug-related intimidation and the impact on family. And then with the lockdown, I think we saw additional pressures put on projects. So this is an ongoing piece of work where we invite projects to come in and workshop these issues. And then hopefully what we'll do is do more individualized support for projects so they can get help to plan to run their service in very restrictive budgets. We haven't seen any increase to those budgets for a very long time now. We also work on the strategic role of the task force. We have somebody coming in to do some communications work with us at the moment. We coordinate training for services and service users where possible, and then we offer out those training places if we have any in excess to the community. What we hope to do next year is maybe offer a training grant. We've done 4 years of training, and I feel now that projects might be saturated in the training that we offer and maybe have the opportunity to focus on their own sustainability planning or their own strategic development by sourcing training that obviously is relevant to the National Drug Strategy, but is purposeful for the services. Then the community grants are to promote Goal 4 of the National Drug Strategy. We'll probably advertise those next January, February. They will come under Goal 4. Last year, we broke them into two. So we did community initiatives that were about promoting positive mental health, coping with drugs and alcohol in the home and the community. And then we did a separate gardening grant. So we picked particular site areas to really reinforce the sense of having safe spaces in the community where people could go and maybe work on events or programs or training that were related to outdoor activities, predominantly gardening. We also developed different pilot initiatives. We do this under our Targeted Intervention Fund. So what we will do is work on a particular tender. We will put it out as an expression of interest. We can only put it out really to projects that have a current HSC funding code. Again, as we're not a funder, we can't fund any sort of project. But what we do is we invite projects maybe to collaborate with the funded project to be able to deliver on these initiatives, or to partner, which we've seen some really positive results where projects within the South Inner City Drugs Task Force have partnered on the New Communities Initiative, which was CKU and Community Response. Artis Key got involved in Coolmine. And that's, for me, is really good interagency working. So for our community response piece and the Irish Human Rights grant, the task force wanted to do this grant, but because it's not a limited company and it's not a project in itself, we approached projects that were working with new communities and had experience previously to come in and be the partner and the lead. So community response were awarded that brief. It was fantastic because they had previous experience doing the New Communities project with us, which informed the content of this grant. So that grant is currently being actioned. It was put out to tender. Quality matters, won the tender. So it will take place over a period of a year. And I think what we realized was that a lot of the services weren't really able to adapt to the diversity of people that were seeking support. There was certainly a language deficit there. Most of us only speak English. A lot of the information is only provided in English. But what we learned from the previous piece of action research was that it went beyond just a language block. It was more about understanding different cultural needs of people that come to services and who need not just help with addiction, but maybe just with their general health. So the aim of the project is set out there. I won't read it out for you. But if you're interested in any of the updates or the reports, we're happy to share that information with you.
Cool. I think
that's it.
Yeah, that's great, Keri. Thank you. I think that brings it on to me next.
Yeah.
So I suppose I'm JM. I am a team leader, the OID team leader here in community response. And I suppose just by way of introduction of the service, it's, as it says on the slide, we're a primary alcohol and liver health service based in Dublin 8. And we offer a number of options for people who are impacted by alcohol use. We work with individuals at various stages, either from still drinking to being sober for a period of time. We try and sort of help them find the next steps as well. And also we work with family and concerned people of people who use alcohol. So it could be somebody who's living in a house with someone with alcohol problems, or it could be a partner or a child or a parent, or that any of those things. We mainly would offer group supports, but we do also offer some one-to-one supports as well. In addition to that, we are also working with individuals affected by hepatitis C. We currently have a project worker who works part of the time working with individuals, helping them navigate treatment pathways. And we also are a member of the Hepatitis C Partnership, which, as it says here in front of you, is a national network of organizations that focus on ensuring Hep C is a rare disease by 2030. And I'm sorry to say that number is is very optimistic at present. They're looking more at 2045 or 2050, but sure, we will keep plugging away. So some of the things that we have offered with relation to hepatitis C is pretty much up to when COVID struck. We were working in partnership with HSE Castle Street OST Clinic to roll out community pilot and support program, and to also provide peer support training. So that would have been individuals who were hepatitis C positive, had gone through treatment, and were essentially treatment advocates. Sort of a buddy system. You may be familiar with that type of work. Additionally, we're working on an information campaign called the Roadmap to Zero. That's a really basic way of explaining it on the slide here, that the project seeks a better understanding of the care pathways for people living with Hep C. To flesh that out a bit, it's an information gathering exercise of individuals who would have had experience of hepatitis C treatment. That could be care providers, that could be individuals who have gone through the treatment in the past or currently going through the treatment, have been a friend, relative, or partner of someone who's gone through the treatment, basically to find out what the real lived experience is and to put that into a report, which will then be delivered most likely at the end of this year on what the findings are, in order to better whoosh that date along of 2030. We're also working in conjunction with the Mater Hospital to co-facilitate information sessions in the community. You'll recall that I just mentioned our worker who assists individuals in navigating the Hep C treatment pathways. Well, this individual also is paired with the Mater Hep C peer support worker and the Mater hepatology nurse in going to community projects in various parts of the city, and facilitating testing and information that's done on site, and then the individual is sort of fast tracked into treatment. So the future plan with relation to this service is to offer it on either a bi-weekly or a monthly clinic service out of community response. We're sort of finalizing that with the Mater Hospital at present. Okay, the next piece is our action research piece, which came out of the South Inner City Drug and Alcohol Task Force Targeted Intervention Fund. Essentially, this was, as again, it shows, I hate reading off of PowerPoint, folks. Sorry if it seems a little bit buckety. What we were trying to do with this was to find out why there's lots of people on the streets using and drinking in the Liberties mainly, but generally in the SIC task force area, and to see what sports they were linked with, if any, if they were, what they were getting out of them, if they weren't, why they were not using them, if they were aware of them, if they weren't aware of them, and to also encourage them to use them if they didn't know about them. And do a very, very brief intervention-y piece. So the idea is that we will then provide a report at the end of it to the South Inner City Drug and Alcohol Task Force, outlining what we found. It sounds a lot more complicated than it is. It's about asking people, like, for example, you can talk to anybody in drug and alcohol services, in community services, really, and you can say, okay, lots of people are anecdotally accessing services, but they're not getting these particular needs met. But we hadn't done a piece of research in this specific area around that. So that's kind of what this is trying to do. So these are the objectives: engaging with people using the hotspots that were identified by the community. I think that you guys on Corn will be aware of the fact that we were looking for information from yourselves a few months ago on those specific hotspots, and thank you very much for passing them on to me. Also, the South Inner City Task Force provided us with a list of spots. But in addition to that, we also, through street outreach and seeing where people were by rambling around Dublin 8, we identified spots in that way as well. And so established the number of people using the site, established people using other services, and to work with other community groups. Essentially what I just said to you. So I'm going to move on from that. So we completed 80 surveys between August and October 2021. This was all happening during business hours, Monday to Friday. So it's just kind of the hours that we work. We were prepared to do weekends or evenings if needed, but we found so many people during this period of time that we kind of stuck to that. We did a bit of interagency work with Merchants Quay, as they have several different outreach teams, or they did up to a couple of months ago, in as much as they had a harm reduction intervention team, which is now, as I understand, based back in their Riverbank premises, and Cool Minds outreach team. We piggybacked with them to do a little bit of help with them in their work, and they helped us with this piece of work. So that was a nice piece there. I suppose, without getting ahead of things, one interesting aspect of the interagency piece, because it was a key point or a key objective of the work, is that it worked okay. Now, these other organizations, their outreach was there for a specific purpose and for a specific time, and they were essentially helping us out as opposed to being fully invested in the piece that we were doing. So that was something that we discovered was not always, we weren't always singing from the same hymn sheet, which is understandable. We had a lot more, I suppose, success meeting individuals and filling out questionnaires when it was individuals, specifically from community response, specifically going out for a period of time to target individuals doing that. Again, anecdotally, you'd expect that, but it's nice to have that recorded. We had 20 locations total in the area, primarily in the liveries, some in D2 and D4. I think we had 12, off the top of my head, because I didn't write it down here. We had 12 with, out of the 80, I think we had 8 specific locations where it was one individual. The rest of the 12 locations were more than one. And most individuals are linked with some type of addiction support service, mainly opiate substitution therapy clinics, which also was interesting. So people are stitched in with some type of addiction service. It's just, I suppose, the quality of what's coming out of that piece of work. So phase 2 of the research is to follow on with questions for a percentage of the 80 who've consented to be contacted, and we're going to drill down some questions from those. If individuals are currently engaged with a key worker or caseworker or have an active care plan, and if they have had contact with specific types of street outreach services in the last 4 weeks, the 4 weeks prior to the call, as opposed to getting people to think back till when they met us, because as you may be aware, a week is a long time in the lives of service users who are hanging out on the street. And reporting the key findings recommendations will be completed in December of 2021. I think that is me. So I'm gonna hand this over to Niamh now.
Hello, everyone. If you are okay to go to the next slide, Jem. So I suppose I'm actually working with community response and the community alcohol detox initiative at the moment. And so just to kind of give a little bit of a background, the initiative was set up in 2019, and I suppose funding was kind of granted by the government to 12 different initiatives to target drug and alcohol use. And there was 12 different initiatives right across the country, and the Community Alcohol Detox Initiative is one of those. And obviously we're looking at the strategic vision, which is to improve the health and well-being of people who are engaging with problematic alcohol use. And it's covering 4 task force areas. So the South Inner City, the Canal Communities, Ballyfermot and Dublin 12 and Crumlin. And I suppose the main idea of the Community Alcohol Detox Initiative is we really want to kind of set up a manual that would be like a best practice manual that can be used by anybody who is directly related to community alcohol detox. So that would be GPs, service providers, service users, and then across that manual, then within that we will be looking at, you know, really kind of trying to strengthen the relationships between GPs, service users and service providers. And again, it kind of goes back to what Keri was talking about earlier, you know, that interagency piece of work and how important that is as part of this initiative to kind of have everybody involved, because communication is key with anybody who's looking for a community alcohol detox initiative. Jem, if you can go to the next slide, if that's okay. And to date, the initiative has been run since 2019, and I suppose to date we've done consultation with various stakeholders. So far we've done a lot of service user questionnaires and feedback, and we've gotten some information back from service users about their experiences with community alcohol detox. A huge theme and a huge thing that's coming back from all three stakeholders is that kind of the awareness of psychosocial supports in the community, and kind of sometimes the breakdown of communication and breakdown of referral pathways, and sometimes that can obviously damage the kind of continuity of care for somebody who's looking to detox in the community. Obviously there are other things that service users had identified, you know, like stigma and fear and kind of asking for help, and maybe not actually, like a GP might not refer them to the right service or whatever the case may be. As well as that, then we've done a service consultation piece. So last year, there would have been a consultant who would have engaged with service providers across the 4 task force areas, identifying what programs and services the different organisations are offering and that directly relate to community alcohol detox. So that would be, you know, one-to-one supports, group supports, counselling, a various range of different supports, and we would identify them projects, and I will be continuously liaising with them projects as part of this initiative. And then lastly, at the moment, we're currently going out and speaking to GPs and getting their insights from a clinical perspective. Because I suppose obviously without a detox, you can't have a detox without a GP. But I suppose a huge thing that's kind of coming back to that as well is, again, it's that kind of lack of awareness, and that kind of, I suppose GPs sometimes maybe feel a little bit isolated because they don't know where to refer service users to. So as part of the initiative, our biggest thing is really to kind of create that awareness and create that education across with community alcohol detox, so that GPs do know where key workers are, and GPs do know where that they can refer their service users to for psychosocial supports. And then lastly, then as part of the initiative, we would be looking at strengthening the capacity of different services to respond to community alcohol detox and be able to, you know, do, and we've offered training as part of that initiative, and the training that's been offered is motivational interviewing and key working and care planning as well. And then in terms of going forward, so that's kind of mostly what we've been doing today, and as well as that kind of really kind of developing those interagency protocols. Consultant over the coming months in actually developing a best practice manual. So as part of the consultations that we've done to date, that is going to inform our manual. So like an example might be, you know, somebody comes into their GP, they're looking for a detox, and rather than the GP maybe just offering the Librium, the protocols maybe would be that the GP would refer the person to a service. The service will be set up with a key worker, a care plan will be done as well, so that the service users continuously being supported throughout the process. As well as that, going forward, and I suppose I would be working closely with whoever is going to be doing the write-up of that manual. And there will be kind of clinical protocols and kind of the roles of everybody involved within that as well. But we will be looking at kind of setting up set referral pathways. So it's not just that the GP would ring me and I would signpost them to the direct service, but that the GP will know a named person in different organisations across the 4 task force areas. If somebody comes in, they know exactly what services are out there. And as well as that, services know what GPs they can maybe go to and get support from should they need it. And then I suppose, as well as that, over the coming months, we will be developing workshops as well. And we've been working quite closely with the Simon community, because I suppose they've they do quite a lot of work around residential alcohol detox, but they would have a lot of insights into what it's like for a person to be doing that. So we will be doing workshops associated to that. And lastly, we will be hosting a webinar on the 17th of November, which will be raising awareness around this initiative and really kind of trying to define what community alcohol detox is and what we need to make it as successful as possible and create the best outcomes possible. So if anybody has any questions, just let me know. And my email address is actually on that as well. So